All right, so we are live, and I'm so sorry. I'm still trying to figure this thing out. Okay, so I'll give folks a couple seconds to come in the room. Again, my apologies. So I have Dr. Michael Knight joining me tonight. He's going to tell you a little bit about who he is and introduce himself in just a second. We had some folks in the room, and I'm sorry I had to end that live, so we'll give you a couple seconds to come back in. All right, so let's get started. So this is Men's Health Week, and similar to what we did last month for Women's Health Week, we dedicated the entire week to topics related to women last month and men this month. So we talked about sleep apnea, erectile dysfunction, and I wanted to talk about obesity and weight management as well. And instead of me talking about it, I thought it would be great to have a male obesity specialist talk about his experience with managing men and managing weight. So part of this topic is really a part of the whole Men's Week thing. So I wanted to invite Dr. Knight on to talk to my audience. So Dr. Knight, tell us who you are and what you do.
Sure, thanks for having me on the call. So I'm Dr. Michael G. Knight. I'm a physician, internal medicine, and obesity medicine specialist here in Washington, D.C. I'm on faculty at the George Washington University, and that's where I practice in our general internal medicine clinic, but also our happy to be here.
Okay, awesome. So, Dr. Knight, the other thing that's really special about your experience is that you've worked specifically with veterans. So did you see a lot of weight management in the VA?
Yeah, so when I was previously I was in Philadelphia VA, where we started our first medical weight management program that I led for about a year and a half. And so we definitely did. I think veterans are just like everybody else, dealing with excess weight, dealing with obesity. And the great thing about the VA, they have a program called the MOVE program that allows veterans to get these kind of services for little or no cost. And so it was a great experience, but also learned a lot about how men address weight and how we address weight with men.
Okay, so let's delve into that topic. So how do men approach excess weight?
Right, so I think it's a couple of things, right? So it's what is prompting people to come and lose weight. And it also depends on how much excess weight we're dealing with. For many of my male patients, a lot of the impetus for them to come is a health reason, right? And so obviously the extremes of excess weight, there are more folks who will come in more of how they feel, how they look. But a lot of my male patients that come to me because they've just been diagnosed with diabetes. Mm-hmm. Their blood pressure is out of control. You know, their wife or their partner is telling them, you need to get your health together. Or maybe there's a physician, a primary care physician, who's encouraging them to lose weight. And so when they come to us, we work with them to do that.
Okay. So, and that may actually be a little bit of a gender difference. A lot of times we see women come because of, their own accord. And it sounds like in your experience, a lot of the men came when there was a new disease or some type of health catastrophe. Do you think that society has anything to do with that? Men gain weight and it's a symbol of power and status. Do you think society has anything to do with what brings men in to see us?
I definitely think there are cultural things. I think, the thing about excess weight or obesity is that that's one disease process that everyone can see, right? It's so different than blood pressure or diabetes. You never know someone has it, but with excess weight, you immediately see it. And so culturally, I think we have more of an acceptance of men carrying a little bit of weight on them. Mm-hmm. Even sometimes it's encouraged. So I usually will see my men, and as I said, if there is at the extremes of excess weight, then that's more of a physical issue. But most of the time it's coming in because it's starting to affect their health.
So when you would work with men on weight management, did you feel like they were they were easy to adopt some of your recommendations, or did they not feel very interested in doing some of the things you wanted to do?
I think one of the most important things to allow them to do that is really coming up with a customized approach. Mm-hmm. Many of the men that have come have tried, they have tried other programs, we have tried different groups. I'm not going to name names of different weight loss programs that are out there, but I'm sure imagine the number. And sometimes there are certain ones that are not as much towards men. A lot of the men, they don't necessarily want to, aesthetic. They may not, want to have your buddy or check in, but they do want to have a comprehensive plan that's their interested in choices, how they can express things. So I found that with men, I'm really encouraged to have a customized approach.
Okay. So let's talk about, the way that weight is deposited on men. Did you notice any differences, just looking at the body composition with men compared to women?
Yeah, there's definitely a couple of things that have been widely published, and so it's not something that I came up with but something that we know in the field of obesity medicine. We know that men often carry their weight a little bit differently than women. Most people can see that. Men are more likely to carry it in the abdomen area, so having the larger or rounder stomach, and not as much in the legs or in the behind as many women do. And so it's kind of a plus and a minus. The plus is that when men start losing weight, you really see it a lot faster oftentimes, because those are the areas that you can quickly. But on the negative side, is that's the worst place you want to carry weight, because we know that when you carry weight in the central area of the body, you have increased risk for cardiometabolic disease. And so that's one of the things. And secondly, we know that men often have a larger percentage of lean muscle mass versus women. So just on the basic of genetics and our hormonal composition, women are more likely to have a higher percentage of body fat. And that sometimes that's okay. And it can be expected. Again, we're talking about extremes. But when all things be equal, men on average have a higher lean muscle mass and a lower body fat percentage.
Okay. And can you explain for our listeners why, what is the underlying mechanism of that? Men having more lean muscle, less fat, having a different distribution. What determines that for men?
Sure. So, we know that this linked to our hormonal process. So the higher levels of testosterone that men have naturally, that's going to encourage the muscle mass build up. That's going to encourage, increase resting metabolic rate for many of our patients. That's another thing that oftentimes we'll have, and sometimes I'll have couples come to see me, and they're eating the same thing, they're doing the same thing, and the man is losing weight, the woman's not losing the weight, and everyone's upset. But, there is that physiological process going on. And so because they have that higher percentage of muscle mass, their resting metabolic rate is often higher, and they have a higher. And when we talk about resting metabolic rate, that's what most people call, my metabolism, right? So they'll have a high metabolism, have a low metabolism. You're talking about that resting metabolic rate. That when you're not doing anything, what your body is burning, just living.
Okay. So it sounds like, just to clarify, men have some advantages in terms of weight management. They have testosterone, so they're going to be more likely to have lean muscle mass. They're going to be more likely to have less fat. They have a different distribution of fat. And in addition to all of that, as if that wasn't, advantageous enough, they also are going to have a higher resting metabolic rate, which means they're going to burn more calories and potentially lose weight a lot faster. So, that's one of the burning questions that I actually had for you tonight is, why do men lose weight so much more effectively, quicker, easier than women? And it sounds like it has to do with the male hormone testosterone at the end of the day.
And that's one of the things. I think there are a couple of other factors that play their role. We know the role that estrogen plays for women, and so it's actually protective and encourages a certain level of body fat mass, right? And so because of that, women, it's harder for women to do that because the hormonal milieu, if you will, in their bodies are encouraging, holding on to some of that weight. Know that mentally, the body, good for baby. If a baby's going to be coming, it's good for women's health. And also, remember, women are carrying the weight place. And so that weight it does not necessarily have the same level of physical or cardiometabolic that women.
Okay, perfect. So I want to jump quickly to a topic that we actually talked about with my followers yesterday, which was erectile dysfunction. So we talk about how testosterone helps men with weight loss, but is it also possible with weight to reduce the amount of testosterone that one has? And how does that play into erectile dysfunction with your, overweight and obese men?
So what we know is that by having higher levels of fat mass, you have higher conversion of some of our sex hormones into estrogen. Okay? So everybody has estrogen, everybody has a little bit of testosterone, right? So it's not like men have no estrogen, women have no testosterone. What we know is that in the body fat that we see, it's not just sitting, right? So there's a physiological component to fat cells. And oftentimes they're able to convert a lot of these sex hormones estrogen. And so even in men, having that increase of that hormone in the system, which is not normal, shouldn't be, that can decrease libido and often sometimes lead to erectile dysfunction.
Right. So I want to ask you about this. Do you, kind of along the same lines, do you get a lot of men who, we talked about obesity being something that you can see. Do you get men who look at the changes in their bodies and they may come to you and complain about man boobs and ask about what to do about it? What are man boobs? How does it happen? And what would be your recommendation for someone who wants to get rid of that?
Sure. So medically, gynecomastia or growth of male looks like breast can be seen in a variety of conditions, but also as people put on excess weight. Also the way that they look. So there are some folks who have excess weight and don't necessarily have a development of breast mass, and then some that do. A lot of that has to do with the hormone. How do you get rid of it? So that's one of the areas that's a little bit tough. I think most people who are dealing with excess weight know those areas that are working out as hard as you can. It seems like those areas don't want to budge. But with significant weight loss, you can definitely decrease the level of fat tissue or glandular tissue in the breast area for men. But sometimes they're required to have corrective surgery in that area because it's just such a difficult area to weight. And again, everyone's a little bit different. A lot of times it's genetic, the way you carry your weight. Looking at other folks, that also plays a role there.
Okay, awesome. So, do you have any tips for men who want to reduce their weight?
Sure. So again, I think the best, they always say, well, what diet should I be on? Right? Southeast, Cornish, Mediterranean. The diet that is going to work for you and that you're going to be able to sustain is the diet that is for you. Right? So I don't even call it diet. When I talk to my patients, we talk about our nutritional approach, our dietary approach. Because it's not a diet that you're going to be on for you. It is a lifestyle change, and it needs to be something that's sustainable. And so with my men on our first visit, I'm talking about, and then moving from there to see how can we introduce concepts to reduce things, and also looking at what other diseases they may be dealing with. Someone with diabetes may have a different approach from someone who has normal sugar levels and no insulin resistance. Mm-hmm. Another condition that we know is very centrally involved in excess weight. So it's definitely about a customized approach, and I think just coming in and saying stop eating this and completely fill this out, not always an effective way. I am about moderation and decreasing. So if you're drinking 2 sodas a night, we're going to bring it down to 1 soda a night. We're going to bring it down to every other night. And eventually we'll eliminate it, but not immediately. And I have found that oftentimes when you come to patients, not just men, but women as well, and say, I want you to completely go 180. Some people can, and some people, it's that pushes them away.
Right.
So it's about the understanding where they're coming from and being realistic, and also setting realistic goals.
Yeah, that's awesome. How do you feel about the men who, they're excited to get into the gym, they want to work out, they want to, and by workout, I mean lift weights, which we know men tend to want to do that type of stuff versus cardio and other things. But how do you feel about the male who wants to lose weight with exercise and pumping iron, and may not be addressing other things? What would be your advice to them?
Right. The key to weight loss, that we know is going to be through nutrition. There has to be a nutritional change. If you don't change anything about what you're eating, you will lose a little bit of weight, but not a lot. I mean, a lot of our studies have shown that it's really only a couple of pounds that could be lost with no dietary change. And even if you're trying to build muscle, you're trying to do things like that, you know that things like macros, like how much protein you're taking, all of those things play a role. So I'm definitely not going to discourage you from going to the gym. I want you to, but I also want it to be a part of a comprehensive plan. So working on nutritional changes while we are supporting physical activity is most important.
Awesome. So one more dietary question for you, and you're the perfect person to ask this, given your personal diet. There's a lot of fad diets now. Vegan, I think, would be the most popular. This time last year, it was paleo, or a couple years ago, it was paleo. Vegetarianism. When we look at men doing these types of diets, there's an assumption that you can't build muscle without protein from meat. I believe you're vegetarian, is that right?
That's right.
As a practicing vegetarian, what would be your advice for men who want to start those diets, and also in terms of being able to get enough protein to sustain lean muscle?
Right, and so I think it's a little bit easier for vegetarians because there are a lot of other options to get protein. So we know that a lot of those protein powders that you see folks in the gym thinking are from whey protein. Those are from dairy-based protein, and most vegetarians don't have a problem with dairy. So that's usually a great area. A lot of your meal replacements are going to have protein that comes from dairy, so that's also an area. And then you also have your legumes, so you have your beans, you have other plant-based proteins that are available, nuts, things like that. For those who are vegan, it's going to be probably more of the plant-based protein versus others. And it can get a little bit more difficult, but it's not impossible. The folks based on their nutritional desires. So definitely not an end of the road. If you don't want to eat meat, still increase your protein intake. But I still believe that the protein intake is important. So whether or not you eat meat, I still think that is part issue to avoid. A lot of vegetarians end up having large carbohydrate bowls, especially when they're places that only have meat, and then you're eating sides, you'll have a salad or various protein.
Right.
Low your protein.
Right. Awesome. Okay, so my last question, and then we'll open it up to our audience. So I am a big fan of meal replacement. All of my patients can tell you that. Not every patient is on a meal replacement program, but I definitely use it, and I'd say to cheat. I use it for people who are just having a really hard time, or they don't want to do grocery shopping or meal planning, or they're really busy traveling. It's a great way to get protein. It's a great way to control calories and carbs and all of that stuff, and portions. So I'm a big proponent for meal replacement, and we see effective weight loss when it's done properly. Have you had any success with meal replacement in men? And I guess the first question would be, do you even use it with your male patients? And how does that work for you?
Sure. So I do use meal replacement with almost every one of my patients to some extent. Because, as I said, it's an easy way to get your protein supplement. And it's a great way, as you said, to cut down, necessarily cheap, right? But just cutting down your daily average calories. You can replace a meal with something that's only 160 calories times a week. You're bringing down your total average. And so most of my men are on meal replacement. And many of them like it because they're on the go oftentimes. They're running to work, they have family. And so grabbing a shake in the morning instead of making breakfast is very convenient. And so they have used it to bring down the total average calories. And then also it allows them to still get that protein that a lot of them miss when they skip breakfast.
Right.
Very common, as we know, the skipping of meals. And so this allows that, okay, you're not super hungry, have a shake, get your protein fix, that pulls down your appetite to cut out that snack.
Yeah, awesome. All right, so we'll take some questions from our listeners. I'll give you about 15 seconds. Oh, good. Okay, so for men or women, is there a natural or automatic way to increase your metabolism, like sitting leg lifts? That's a great question.
I mean, I think anytime you start building lean muscle mass, your metabolism is going to start to increase because we know that it is connected to the amount of lean muscle mass that you have. And so oftentimes for women, we're like, well, I don't have that much lean muscle mass. Then how can I do that? How can I increase it? By doing some resistance training and starting to build that lean muscle mass, you're going to be able to raise your resting metabolic rate naturally.
Mm-hmm. Okay, so it sounds like the leg lifts could potentially help you to do that. People do calf raises and other stuff. Do you think that's significant enough to cause an increase in metabolic rate?
It depends. I mean, it depends on how intense you are about it. I think that's always a question that comes on. And oftentimes, everyone has a little activity tracker, and activity is important. And I think what we know is that any kind of activity is important for cardiovascular health. So that's heart health, brain health, just being active generally. When we talk about weight loss, there's significant weight loss. It needs to be at least moderate intensity exercise. And it needs to be, your heart rate needs to be increasing. I always tell my patients, haven't wiped some sweat off your brow, you're not sweating hard enough. You want to walk, that's fine, but you need to be walking like you're trying to get to bus. There has to be some urgency. There has to be some resistance, moderate intensity. Because I see a lot of folks who walk all day and say, Dr. Knight, I've been walking every day for an hour. And I'm saying, well, are you walking or are you walking and brisk walking? Mm-hmm. Oftentimes, especially if they're walking to work, you don't want to come into work flustered. So usually I say, if you're able to go to work or go to things, then after your walk, it probably was not brisk enough because you should have been sweating, you should have been out of it. Just want to kind of feel that burn, as they say, in your work.
Okay, good. So any other questions? All right. Well, thank you so much for sharing your expertise. A lot of good tips for men who are interested in weight management or weight loss, and a lot of good insight with your experience working with the majority male population in the VA. And I'm sure being a male physician, sometimes we attract the similar gender. So I imagine that you also have a good number of men in your weight management clinic at GW as well. So Dr. Knight, please give everyone your information in case they want to contact you, schedule an appointment in DC. How would they do that? Or even follow you on your social media? What information would you like to share with them?
Sure. So you can find us online, my official practice, so gwdocs.com. You'll find information on the George Washington Medical Faculty Associates, and you will find my name under Dr. Michael Knight. You can also give my office a call, old-fashioned way, make an appointment with me, and that's 202-741-2222. You can also find me on social media, so I'm on Twitter and Facebook at MGKnightMD, and that's where you can find me.
Awesome, and we will be sure to share all of that information attached to this video and also on YouTube. So thanks so much for tuning in. Thanks, Dr. Knight, for joining us. Good night.
Bye.